Day, I am Divyah from Group 25. Today, I will be talking about assisting patients with tracheectomy and also laryngectomy. First, let's start with what is the difference? What is tracheostomy? What is laryngectomy? Why do people always misinterpret this term, thinking that they are similar? Why does this occur? What is it all about? Let's get started. So basically, one is whole. One is removal. So a tracheostomy is actually just a breathing hole in the neck. Nothing is removed and the airway is intact. However, a laryngectomy removes the entire voice box or also partial of that voice box. So there is no connection between the throat and the windpipe, which is the trachea. So that hole is the laryngectomy patient's only way to breathe. And they must have another way to speak other than the voice box. So that is the difference between tracheostomy and also laryngectomy. Tracheostomy, it means hole. Laryngectomy is the removal of larynx. Let's start with tracheostomy. So tracheostomy, it may be temporary, it may be permanent. An incision is made on the neck for air to enter, and also the external opening of the surface, a stoma, is created. So this tube that is inserted is called a cannula. So a cannula, there's inner cannula and there's also an outer cannula that is used. And there are several types of outer cannulae that is available. So the most common one has an inflatable tube. So this inflatable tube, it's actually to seal or reduce the airflow to the nose and throat. So virtually all the breathing is done through the tracheostomy. So it seals, so all the breathing is done. So the parts of tracheostomy, I've shown it in the picture down here. So these are the parts. There's the outer cannula, there's the inner cannula, there's also the tube, there's also the belt, everything, the balloon. Let's start with laryngectomy. Laryngectomy, earlier I've said, is removal. Yes, it is the removal of larynx. It is actually done as a treatment for cancer. And the airway is separated from the mouth, nose, and esophagus. So, when the larynx is removed, there is no longer a connection between the upper and the lower airway. So the laryngectomy, like I said earlier, it may seem like a regular tracheostomy, but it is very, very, very different because you must know the type of device each person has. When a patient has tracheostomy, the passageway from the mouth, nose, through the trachea remains intact. So the patient continues to be able to smell, to be able to blow, to be able to drink liquid to straw. However, a patient who has had laryngectomy has had larynx, the voice box, removed. So the upper airway is no longer connected to the trachea and the patient can no longer talk. A patient who has had laryngectomy cannot smell, cannot blow their nose, cannot whistle, cannot gargle, cannot drink liquid through straw because the surgery is permanent and there's no connection here. So the person will never be able to do all this kind of thing other than the person that has tracheostomy. So the person that has tracheostomy, they can do all this activity, but laryngectomy, they can't. The next I'm going to talk about is what is the purpose of this surgery. So both of this surgery, only one similarity is it creates an artificial airway for patients. So what is the purpose of this artificial airway? So artificial airway, it provides adequate ventilation and oxygenation. Number 2, it maintains the patterned airway and also it eliminates any airway obstruction. Sorry about that. So, and also it reduces the potential for aspiration and it also provides access for secretion clearance. Like for example, there's a lot of secreted mucus and all that. So yeah, it provides clearance for patients. So these are the main purpose for artificial airways. Next, before I jump into assisting a patient with tracheostomy and laryngectomy, we must first know any contribution factors that may lead to an emergency, because while you're giving care to a patient, you must make sure that these are not happening or these are not being done, so that to avoid any emergency to occur. During care, we must always see whether is there any overproduction of sputum, because this may block the passageway. Is there any coughing? Is there any irritation of trachea? Is there any undue movement of the tube, the laryngectomy tube, the tracheotomy tube, any tube? Is there any movement? Is there any like dry or hardened secretion? Is there any sputum plaque that is blocking the airway? And also, is there any dysphagia or aspiration of stomach contents? And also, you have to check whether the cuff integrity is compromised or not. So these are the main factors that actually contributes to an emergency. So we have to look out for these signs. So when it comes to ventilation for tracheostomy versus laryngectomy patients, so tracheostomy, of course, via the stoma. So trach patient, they inflate cuff to form a seal, whereas laryngectomy, they insert an endotracheal tube or a tracheal tube into the stoma. They insert it and inflate the cuff. So for laryngectomy, of course, there is no ventilation via the mouth. However, for tracheostomy, there is ventilation via the mouth. And we must not forget any oral airway maneuvers that in emergency when it comes to obstructed tracheostomy, Let's start with assisting patient with tracheostomy and laryngectomy.
Start by wearing your gloves. Explain to patient what you are going to do. First, inspect the patient. Look for any signs of sputum or any signs of airway obstruction. Make sure the belt is also intact and not compromised. Look for any emergency factors. People with respiratory disorders often need help removing secretion from airways. There may be sometimes large amount of sputum, anything that obstruct their airways. Is done using various type of suction catheter. I will show another one later on. This is a soft catheter that can be passed through the nose or mouth or down the tracheostomy tube. Take note that since we are a nursing assistant, we will not be responsible. Do not suction the patient, but you will be responsible of letting the nurse know if there is any emergency needed. Clean the patient's stoma using a stoma wipe. Rinse the cannula, the inner cannula, in a small tub of saline water. Gloved hand, replace the inner cannula into the outer cannula. And right now, I'll be illustrating how a suction catheter is used in a tracheostomy tube. However, a nursing assistant will not be performing this procedure. We will be observing the patient for any emergency contributing factors, cyanosis, any obstruction of airway, looking at their skin, looking at their cleanliness and all that. Now let's get into self-care for laryngectomy tube. Patients usually do this by themselves, but if a patient is unable, then yes, nursing assistants will help. So first, we will need to remove the laryngectomy tube. Make sure your hand is clean and you're wearing gloves while doing this. Once you have removed properly the tube, you then use a laryngectomy valve cleaning brush to clean the valve. Make sure you have a good light source while doing this. You can then use stoma wipes to clean around the outside of the stoma on the skin. If you don't have stoma wipe, you can use mild soap, water, and face flannel. Once stoma is clean, you can then insert your laryngectomy tube. Attach the tube onto the edges of the holder and place it properly. As nursing assistants, we aid patient breathing by proper positioning and also provide moisture and oxygen. We will be responsible for making observation and reporting to the nurse. Observations such as respiratory rate, noisy, dyspnea, color of face are vital. Thank you very much.